Hi, my name's Daniel Wood. I'm a radiologist at Bay Health. I first thought that I might want to go into medicine when I was in undergrad. At first, I always knew I liked science and wanted to do something in the science field. Initially, I thought I might want to be a research scientist, but I did a couple summer internships at Pfizer, pharmaceutical companies, and felt that I liked the work, but I was missing the connection with people. So I kind of reconsidered my options and did some volunteer work at the hospital, and had a family friend who was a radiologist and shadowed him at his job and thought this was, a field that I would be interested in. So the reason I picked radiology was that it has obviously very high-end technology that allows us to see inside of the body, and radiology is they call it the doctor's doctor. So the internal medicine doctors and ER doctors, they're the ones trying to figure out what's going on with a patient, and a lot of times it comes down to what the imaging shows. And so it's a great responsibility to be able to look at the pictures of the patient and put it together with their clinical picture and try to solve the mystery of what's going on, and then relay that to the referring doctor and allow them to formulate a treatment for the patient. So radiology is a tough job in terms of there's limited ability to interact with the patient. A lot of times we're in the reading room, looking at scans while the patient's sitting in the emergency department, or they may be at an outpatient clinic, or they may have had their CAT scan done and now they're gone and they're sitting at home. I went into breast imaging, and I specialize in breast imaging, which gives me a really great opportunity to talk with the patients, because here at Bay Health, anytime a patient comes in for a diagnostic mammogram or an ultrasound that they're having a problem for, or if they're being called back, they have a screening mammogram that they're being called back for, we bring them in to my office and I discuss with them their results. I show them the pictures and tell them what the next step is going to be. So the most rewarding part of my work is when I find something on a mammogram that's very small, something that a woman's not going to be able to feel, or a doctor's not going to be able to feel on a physical exam, and we work it up, and it turns out to be something that the woman needs to deal with. Sometimes it's a small cancer, which is unfortunate for that person, but I'm satisfied that I caught it at such an early stage that the treatment will be much less invasive than if it had gone unnoticed, and was discovered years later when it was at a much more advanced state. So it's those early pickups that I get that really are rewarding for me.